What's up, guys? Now in this video, I want to speak about a little bit what is my plan for the future, about uh, the creation of nutritional plans for patients with different diseases. My idea is basically to create one, use AI to try to create one good nutritional plan for it. I was having uh, the response that got Os Ladino to Joel Furman. And basically, I saw again that basically I am seeing that Paul Saladino has many valid arguments to say that one carnivore diet is good for the people. But if we speak only with arguments, I would like to see one patient that was capable to get over cancer, to beat cancer. I couldn't to find because I was seeing this video. But basically that is one thing that is difficult to imagine for me. I want to see
While we're at it, I'd like to also
little
check.
bit carnivore diet, diet, cancer, cancer survivor. Now I will search superficially what is if what is happening with testimonies where say that it was capable to beat cancer with carnivore diet. The carnivore diet will save you. I want to see. Okay, I am in videos. I believe that lost one valuable information. Now here is one. Want to see this video. Vegan diet, carnivore diet. I don't want is another defensor, another advocate of carnivore diet also, but I want to see results. I don't only want be. I don't want only listen arguments. I am seeing lost shorts. Don't want to see shorts. Or maybe yeah, maybe I can find testimonies. Carnivore diet, colon cancer, screening age. Okay, I remember another video of this man. Where is Showbaker? Uh, Showbaker cancer. Cancer on the rise in young people. Okay, no, I don't want that. I want the testimonies finding of cancer with food. Okay, I want to see a little bit
Just keep listening to yourself. I mean,
what
like I said, there's always going to
what are I speaking about in this video. Cities close stay close to end stage kidney failure, recovering from surgery, eczema, Hashimoto, waste, coaching, MU. Okay. It is interesting. Maybe it is one patient recovering from surgery, eczema, models. Okay, like this, but they are not speaking about cancer specifically.
To hear.
Instead, in this video, they are speaking about it. More. Paulo Kelly is 9 year survival of most aggressive form of brain cancer, glioblastoma, which generally carries with it only 3 months average survival after diagnosis without conventional treatment, and an average 15 to 18 months with completely surgical. Okay. This man realized one surgery. Carries with only 3 months average survival after diagnosis without conventional treatment, and an average 15 to 18 months with completely surgical resection, chemo, and radiation. No leaking, no odds. Pablo looked for alternative approaches to treatment and found the work of Professor Thomas Seyfried of Boston College, a previous guest of this podcast and channel, and use his research the dietary effect on cancer treatment heavily influence a progression of this condition called ketogenic metabolic therapy. This method growing body for literature and data to support its use in cancer of all sorts. The complement to or even as standalone therapy in combination with traditional chemoradiation. In combination with traditional chemoradiation, it has been shown to increase the safety and efficacy to both chemoradiation, and it can also starve out the cancer cells unnecessary glucose. Cancer cells need at the rate of 400 times of normal cells. For more of this, please see this interview with Professor favorite link here. Okay, this is one interesting video. I will review this after. Um, carnivore diet, basically. Here I will save all carnivore diets that is interesting for me. In this case, I believe I will check after more. Will check again this video, but now I want to see. I remember that I saw one video of this man. Our house, giving sugar to cancer patient. Shoemaker on processed foods for addiction. Tailoring the carnivore diet for specific goals with Shoemaker. Shadi squeeze. No, I don't want that. Reversing lipedema. Why Shoemaker went from to keto in my diet. Colonoscopy not beneficial. Colonoscopy not. Tire warning. Okay, I don't find that video. Addiction. Aging is a scam. I lose that video. I believe that lose that video. Okay, don't matter. I will search that after. But basically here I was checking that I was speaking about that George Foreman has arguments. I don't found a lot of arguments, not arguments, testimonies, patients that was capable to survive to cancer with not without realize a conventional treatment, only with diet, only sought patients that realize one vegetarian diet because the paper can't say anything. But I believe that the most important is the results. But if we speak about the reasons because Paul Saladino say that Joel Fuhrman is not right is because the studies who Joel Fuhrman is basing is epidemiologist, and epidemiologists don't realize studies in vitro. I believe that yeah can be one problem because one correlation is not necessarily that exists one relationship between the things, between the disease and the cause. But what about the rest of the diseases? The rest, for instance, I listened that was capable to cure diabetes, both Paul Saladino and Joel Fuhrman. Colitis, if I don't remember, I will check the previous video. Where everyone said that was capable to reverse different diseases.
Last few years too. So right now I'm working maybe half time, and I have more time to devote to things I really enjoy now. So I'm still working, but I have more time to ski and surf, and to bike and to jog and to play volleyball and to run on the beach and to lift weights. So now I'm actually, I've always been pretty physically fit, but I'm actually even more physically fit now at 67 than I was maybe at 60. So I can ski with my legs getting less sore. Like, so I'm able to have more time for climbing mountains and so I'm just so I've always been fit, but I have more time to do the things I enjoy today.
That's amazing. And I think that we're very similar. I went to medical school later in my life. I went to medical school when I was 34. I worked as a physician assistant in cardiology for a number of years before that, and I went back to medical school later in life. But I think that we share the same purpose and the same intention. And it's so interesting that both animal-based diets and plant-based diets can lead to reversal of chronic disease that Western medicine calls untreatable, and that mainstream Western medicine wants to treat with pharmaceuticals. And really
Here where I speak about what are the diseases that was capable to reverse.
Wants to just not, fails to open its mind toward nutrition. So I think that we agree on that in the beginning, that so many of these chronic diseases, autoimmune diseases, psoriasis, Sjogren's,
autoimmune diseases, yeah, this is one general common group of diseases.
thyroiditis, eczema, like I've had, psoriasis. In the beginning, that so many of these chronic diseases, autoimmune diseases, psoriasis
Psoriasis is normally one problem in the gut.
Sjogren's,
Sjogren, I believe that Sjogren also is one problem in the gut. Okay, I don't need to check that. Basically, I need to Sjogren. This one disease in the colon, I believe. Oh, face, eyes and mouth. Heart in the articulation and muscles, fatigue. Oh, I believe that I have problem. Yeah. Okay, I need to check photos about this disease. Yes. It is, I believe that is one disease related with the skin, basically. And I know that all diseases that are in the skin is one problem with the gut.
Autoimmune thyroiditis.
Autoimmune thyroiditis, another problem. Autoimmune thyroiditis is basically one attack from the body to the thyroid. And it is normally because the body is not capable to search what is the root cause of the disease. It seems that the body, the autoimmune system, becomes crazy and start to attack to your thyroid, to your thyroids. But it is basically because I don't remember exactly, but I believe that is mimicry. Mimicry. Mimicry gene? Mimicry. Health. Autoimmune. Mimicry disease. Molecular mimicry. Yeah, basically your thyroid means that molecularly seems to one agent that should not be in your body, as can be parasites, fungi, bad bacteria, and for a reason your immune system is confused, and as molecular mimicry, one time your immune system saw to that agent that is provoking problems in your body. For instance, your immune system saw one parasite and he saved in his memory how molecularly seems how molecularly is, and after we use that information to search where are when agents with these characteristics. For a reason, it is what is basically that is molecular mimicry. That is the reason because molecular mimicry, or that is the reason because one autoimmune disease happened for the molecular mimicry.
Eczema, like I've had, so many of these things, even atherosclerosis. It's interesting, and I think we'll probably get into this in the psoriasis, Sjogren's, autoimmune thyroiditis, eczema, like
Eczema. I believe that it is one problem in the skin. I believe that is eczema. Okay, in Spanish, in English, how is it? Eczema, yeah, in English, also known as atopic dermatitis, is a chronic skin condition that causes. I want to see image. Yeah, basically this one problem with the skin. Also, again, problems with the gut. Normally, there are problems in the gut is because there are agents that should not be there, as parasites, fungi, bad bacteria.
like I've had, so many of these things, even Sjogren's, autoimmune thyroiditis,
Autoimmune thyroiditis.
eczema, like I've had.
Okay, I need to check it again.
So many of these things, even atherosclerosis.
Atherosclerosis. Atherosclerosis. I want to search first one website where are a lot list. This is a list. Glitch. Atherosclerosis. Okay. It is basically one problem with the heart, I believe. But it is related. Basically, I remember that one patient atherosclerosis. The patient must consume heart. The cure must. Okay, what is the supplements that? B complex, vitamin C. This is the supplements that one patient with this should buy. First, I should understand what is the reason because atherosclerosis happens. I know that basically many atherosclerosis happens for the absence of magnesium, a lot presence of calcium, and for a reason you have problems in your heart. Your heart? Okay, I need to reread. Remember, what is happening with atherosclerosis? Magnesium, vitamin C, K2, vitamin intra, vegan oil, vitamin C, vegan diet. Eliminate animal protein, eggs, dairy products, wheat, corn, oil, canola, and fried foods in general for 3 months. You can eat fish once every 2 weeks. You can consume edible organic coconut oil and extra virgin olive with high polyphenols. Carrot juice, don't drink carrot juice if you can't or don't like it. Repeat carrot juice for 3 weeks. If you have diabetes, follow the protocols referred to diabetes. You are a woman. Okay, I need basically it. Sorry for it. Sorry for that. I basically needed to Google what is atherosclerosis. What atherosclerosis? Atherosclerosis, as a hardening. Okay, yeah, I was wrong. It is one problem with arteries. Atherosclerosis is also known as hardening of the how to pronounce that? Arteries? Arteries?
Arteries.
Arteries. Okay. Hardening the arteries is a build up of plaque, in the arteries. Okay, it is one problem with arteries. Basically, one of the cause is the absence of um, magnesium. Magnesium can provoke a stroke, um, cerebral. I don't remember how it named the disease. Generals, not protocols, atherosclerosis. What is ACV? What is ACV? ACV in heart. uh, Accidents cerebrovascular. Yeah, I remember finally the term. The protocols, accident cerebrovascular, infarction. I didn't know that pronounce it that way. Infarction. Okay, I can how to pronounce that.
Infarction.
Infarction, yeah. Infarction, cerebrovascular accident, atherosclerosis. One of cause the normal one of the cause of these diseases is basically one absence of magnesium. And one excess of calcium. It is not my words. I am repeating the protocol that I, or the review, or the videos that I saw of this doctor. It is in Spanish. I refer, and I will refer a lot, many times to this doctor, because basically this doctor has the testimonies, a lot testimonies with chronic conditions that is not possible to reverse in the Western countries. And basically he always speak about that was capable to reverse atherosclerosis, infarction, cardiovascular accident, only consuming vitamin C, magnesium. There are more supplements that you need in it. Also, it is, if you can see here, it is a complete protocol to treat your disease. It is not only by protocol by supplements. There are one diet, and you can use also his Instagram to see testimonies, and also he continuously divulging information, the information that you need to help to cure. It is in Spanish, so that's sorry, but it is the most real reference that I have. I never saw too many testimonies in this Instagram, in any another social media. This testimony, and of course the testimony of Chris with cancer, where basically speak about the cancer. There are a lot of testimonies of cancer, but the point here is that if I return, yep, I was speaking about what happens with diseases, common diseases that was capable to revert. Paul Saladino. I want to say that I really don't know if Paul Saladino was capable to reverse that. I only know that it is one famous doctor, a defensor, advocate of animal of carnivore diet. And Joel Furman, I saw testimonies that was capable, where the patient has that was capable to reverse different diseases. Okay, but I want to listen also. What are the diseases that was capable to reverse? Joel Furman.
It's interesting, and I think we'll probably get into this in this podcast, that both animal-based diets and plant-based diets can reverse that. And so that's a fascinating, I think, truism that maybe you would disagree with that, but that I've observed, and that I think I'm interested in drilling down on, rather than getting,
Drilling. I don't know what it means, drilling. Interesting one for me. Drilling. Okay.
sort of bogged down in the dogmatic wars over either side. But let's just start with this. I thought that as we look at our differing viewpoints, I thought I would ask you, what are your concerns with meat? And maybe we could go from there, and then I might share some of my concerns with some plants, and we can sort of highlight both sides of the equation. So I guess perhaps the beginning question is, what do you think causes chronic disease in humans? And if meat and animal products are included in that, And what are your concerns with meat?
Okay, I want to what are the diseases that was capable to reverse your Furman?
So I spent a lot
Okay.
of time.
Here we have
actually.
the diseases.
So I've been very grateful for the career I've had, and I've touched obviously many thousands of people and had them reverse their heart disease, get rid of
Heart disease. Okay, what kind of heart disease? If we, I only know infarct. I only know that. Maybe there are more diseases I don't know really.
their diabetes.
Diabetes. Diabetes, one another interesting disease. Yep, because I saw also testimonies. There are another testimonies in another video where say that doctors say that was able to reverse diabetes with low carb diet, including meat, diabetes. But there are one specific YouTube channel where one expert of diabetes that is reversing reversing diabetes with sugar. It is a joke. Of course, because there are two types of diabetes: type 1 diabetes and type 2. That the type 1 diabetes, I believe that is the one autoimmune condition, and the type 2. Okay, I don't want to speak about the things of memory. I want to consult really what is diabetes. Diabetes. Uh, Types of diabetes. Diabetes. Tell me, Gemini. Yeah, the type 1 diabetes is caused by the immune system, and the type 2 is caused because the body doesn't produce enough insulin, or the body cells don't react to insulin properly. I suppose that I really couldn't solve if your Furman use one high in sugar, natural foods, of course, to treat diabetes. Okay, but let's continue checking what are the diseases. Some diseases that was capable to reverse. Okay, so your Furman.
Reverse autoimmune disease like lupus.
Lupus. Lupus is one problem in the skin. Yeah, one problem in the skin. Again, if there are one problem in the skin, there are problems in the gut. Basically, if you are really sick or have chronic conditions, it is highly probable that you have your gut compromised, because the gut, there are the majority of your immune system is in the gut. If I don't remember, if I remember good, it have approximately 80%.
And psoriasis and
Psoriasis, another problem in the gut, in the skin, and therefore in the gut. Scleroderma. Scleroderma. This is scleroderma. Okay, for only for the word, I believe that it is one problem in the skin, therefore in the gut. I am not seeing what is happening with it. Maybe one change in the color. Seems that, oh yeah, it seems to be the legal problems in the skin.
scleroderma.
Scleroderma. Scleroderma different to atherosclerosis. For me, it is on similar words.
And rheumatoid arthritis.
Rheumatoid arthritis. What's for arthritis is because you have problems. Normally you have problems in your articulations, in your hands, in your knee. Inflammation, basically. What is rheumatoid arthritis? Okay, I want to check what is rheumatoid arthritis. And it is a long-term autoimmune disease, inflammation in the joints, basically here in the joint, articulations. In Spanish, I want to be sure first. Yeah, articulations. In Spanish, we say articulaciones, but it is joints.
And ulcerative colitis.
Ulcerative colitis. Okay, there are other problem in the gut. It is specifically in the colon.
I spent a lot of time working with seriously ill patients, and I also have
Serious ill patients. Yeah.
now a retreat in San Diego, and I've lived my whole life on the East Coast. And in the last year, I've moved to the West Coast. I was traveling back and forth from the East Coast to my retreat in San Diego, but now I live permanently in San Diego. And people fly in or drive in from parts of the country, and they stay with me for 2 to 3 months, a minimum of 30 days. Mostly people who are overweight with food addiction, but they have other comorbidities, and they're able to reverse their heart disease, get off their blood pressure medications, and avoid bypass surgery and
Okay.
to reverse their heart disease, get off their blood pressure.
Get off their blood pressure. Get off. What is get off? What is get off is disappear. Okay. Oh, I should say, but get off it is also valid. Get off their blood pressure.
Medications and avoid bypass surgery and angioplasty.
Angioplasty. It seems really important. Plasty. Basically, okay. I mean, this one procedure that dilate the arteries or how a veins manage. Dilate the arteries or veins, which veins float to restore flow. It is basically, I believe that it is basically one surgery.
And so I encourage, so I don't have people come in like a health retreat or a health spa where they stay a few days or a week. There are people that really are staying. I only have limited number of rooms, so I only accommodate people who are staying there a long time, so they can drop 50 pounds and go home with the skills and emotional and intellectual knowledge to take care of their health and continue the progress they made and not have recidivism. The standard American diet is full of addictive junk food and all.
Yeah, basically there are a lot of diseases. As basically George Foreman pronounced or said that this Wolpe was capable a lot, was capable to reverse diseases related with skin and therefore with the gut, colitis, also another problem in the gut, problems with the heart, with blood pressure. Now I am thinking that, of course, that not all the problems is basically parasites, bacteria, basically agents that should not be the body. Also, there are problems with toxicity also, but I believe that it is possible to consider that also another agent. But blood pressure, what happened with blood pressure? I many times saw that to this doctor that mentioned absence of magnesium. Many patients that have remember how to pronounce that, infarction. Patients that had infarction is by one absence uh, of magnesium, and normally with magnesium and with vitamin C is capable to reverse that. Diseases, the veins, yeah, I believe veins or and arteries. What is ACV? What is arteries? Yeah, I would like to know if arteries is the same as veins. Artery will be arteries is equal to veins. I don't know. And it will be equal to to blood vessels. That is one task. Blood vessels, veins, and arteries. Diseases there will be all these. If there are diseases related to these parts of the body, there, all that diseases uh, are related with one absence of magnesium and maybe uh, one high amount of calcium. I don't know really. I don't know. But it is another group of diseases also. Problems in blood vessels, veins, and arteries. Then we have another root cause. Probable. I said that the root cause because it's highly probable that it is because one absence of magnesium. Saying that disease was created with nutritional deficiencies.
All types of dangerous ways of eating. So I really have better effects when people have a big exposure to this body of knowledge.
But if we have the root cause of the diseases, I believe that using the right information, I believe that these doctors have the right information, your Furman, Ladino, because they have testimonies. They are not only nutritionists speaking about how to reverse, how to cure. They show results. It's really important. I believe that if you are a nutritionist, it's really important to show result testimonies where not only say, "Hey, my doctor is fantastic." No, my doctor was capable to reverse my disease. Now I am free of disease. Better if the patient is able to say, "I am free of disease." I am not saying that I am better. It's not good, but it is best to see people that are saying, "I am free of disease" or "disease is free." But using the right information, the right sources, sorry, I believe that it's capable to create one good AI agent that is capable to create nutritional plans the most possible. Here I want to most possible near a nutritional plan, the right nutritional plan for the patient. I was thinking that we know the right sources because I asked directly to ChatGPT And I saw that ChatGPT have problems to give protocols to heal cancer. I asked basically what is the best treatment to heal cancer, and he said me chemo, radiation, and optionally you can realize one vegetarian diet. You can use foods basically. Now I am not saying that you can use only vegetables for the cancer, because we are, if it is true, I need to check this video. If it is true, also is uh, probable that is given that the cancer is possible to reverse with meat, with one carnivore diet. That will be crazy for me, but let's speak about later about that. But if we have the right sources uh, of information, maybe we can use that the books that write every author, every doctor, and feed with them to ChatGPT, for instance, to one AI agent, waiting to learn, waiting that AI learned about the books that will be passed to it. I saw some problems, for instance, that I bought books from uh, from Amazon Kindle for web, where are books, but it is impossible to download. I would like to download it and give to ChatGPT to learn about these books, and after that ChatGPT learned the best protocols, the protocols that really works, create one nutritional plan, also giving more information as can be is a chat analytics, for instance, personal information as the basic information as can be the age, uh, the height, the weight, analytics, medical history, uh, also questionnaires that realize the patient when the patient, when the nutritionist or the healthcare professional was speaking with the patient. And with all that information, we will be capable to create. I believe that we are will be capable to create one AI system, AI agent that can help to create the most near possible, possibly the most near, right, the most possibly near to the right nutritional plan that need the patient. Uh, in fact, it can be exist uh, different ways to heal the same diseases, as we saw carnivore diet with vegetarian diet. Maybe it's possible to heal one disease from different with different protocols. Basically, I was thinking that I am planning to implement that. Basically, the first thing that I will realize is uh, attack or start with one doctor. I believe that I have one basic knowledge, one basic good knowledge about how diseases, how reverse the different diseases. And I can use that sources to create one prompt and say, hey, for this use vegetarian diet, for this use use one carnivore diet. For these offer options, you want to use carnivore diet or want use one vegetarian diet. For this, you can use both vegetables and meat, but only using the right sources. The problem with ChatGPT is that I am not saying that ChatGPT don't know how to create one diet, but if you ask directly, hey ChatGPT, what is best diet or the best treatment for this? And I only test with cancer, and ChatGPT said me, hey, to use chemo, to use radiation, and I believe that I believe not. That is not good. We the people don't born to receive chemo's chemicals. It is not part of your body. Okay, but I don't want to extend this more. I believe that I extend a lot about it. But my next videos will be about how to create the one good AI agent to that is capable to create one good nutritional and after see if the healthcare professional or nutritionist desire to edit. I of course one system should allow that if want to realize some adjustment to the nutritional plan that created the AI. Okay, guys, I only want to speak about what I am thinking. Sorry for my problems speaking English. I dominate more on some topics than others. It's my first time doing this kind of videos. I believe that after with the time I will enhance my capability to speak in different topics. Okay, this all for now, guys. See you later.